In the following video example of a patient encounter, notice how this pharmacist uses prior information gleaned from the patient's chart and information she gathers early in the interview to tailor the instruction. Also, note how she provides feedback and closes the session.
Hello, Mr. Smith. Good to see you again.
Hi, Teresa.
Your doctor asked that I talk with you about the new asthma medicine. As it's a little bit different than your current controller, we want to be sure you're comfortable with it. Do you have a few minutes?
Sure.
What did your doctor tell you about this new asthma medicine?
Well, my asthma's been better with that controller every day, but I still can't complete my full run. He said if I take this new one twice a day, it would help.
That is the goal. This new medicine's called Advair. It has a steroid medicine like the Asthmanex to keep the swelling down, but it also has another medicine in it to keep your airways open. That medicine is similar to your albuterol in your quick relief inhaler, but it works longer. It comes in a discus, which looks a little bit different than your current controller.
Okay.
This one comes in different strengths. Yours will have a yellow label on it like this. Have you seen or used one like this before?
I've seen my brother with one like that, but I haven't seen him use it.
Okay. Well, I'll show you how. The way you breathe it in and breath hold is pretty similar to the current one, but there are a couple of differences. Like all inhaled medicines, it needs to be done just right, or the medicine might not get into your lungs. I'll talk you through it and then do it, and then you can try. So the way it works is like this. If I put my thumb in the thumb grip, that'll help me turn it around and expose the mouthpiece. Then I need to push this little lever back, and it'll stay back. And that brings around the next dose of medicine and opens it. But once I do that, I need to be very careful that I hold the discus totally level. Otherwise, I might lose the dose.
Got it.
So sort of like a hamburger. If I tip it, I might lose the medicine. I will blow out all the way so I can take a great big breath in. But be real careful not to blow into the discus or you could lose the medicine that way.
Okay.
The next part should be real familiar. The speed of the breath is fast, but it also needs to be really deep, about 3 to 4 seconds. This way, the medicine can get deep into your lungs. And then breath hold for 10 seconds if you can. This lets the medicine settle in the lungs so it stays behind when you breathe out again. Then breathe out normally, and again blow out away from it. Put your thumb back into the thumb grip and swing the cover back around again. And that'll bring the lever back up to the front so that it's ready for next time. That's it. Now let me show you how, and then you can try on this device. It doesn't have any medicine in it. So I'm going to put my thumb in the thumb grip, swing it around, and I'm going to pull the lever back. I'm going to blow out all the way. And then I notice the lever's still back. When I swing it around, it'll close.
Okay.
That's all there is to it. Okay, why don't you try?
Okay, so open, push this, exhale.
Big breath. 2, 3. 1, 2, 3, 4, 5, 6, 7, 8, 9, 10. That was pretty good. The breath rate and the breath holding were wonderful. But you tipped it just a little bit. You need to hold it really flat.
Okay.
And be sure that you're blowing away, well away from the device.
Got it.
You don't want to lose any of the medicine. Would you please try one more time?
There you go.
One, 2, 3, 4. Good. 1, 2, 3, 4, 5, 6, 7, 8, 9, 10. That was excellent. I have a picture card here that shows each step. I'll highlight the 2 steps about holding it level and then exhaling away from the device. That'll help you remember. There's only a teeny tiny amount of drug powder, so you may not taste or feel anything. When you get your medicine, it'll be in a foil packet and it'll have a yellow label on it. Write the date you open it on the label. It's good for 30 days after that, so you can write that on the label too.
Okay.
This device has 60 doses in it. Each time you pull the lever back, it'll count down by 1. The last 10 or so numbers will turn red. This alerts you that it's time to call the pharmacy for the next one. There's no major cleaning, just wipe the mouthpiece if it looks wet. This needs to be kept away from humidity and heat, but also in a place you'll remember to take it. What might work for you?
I kept the other one on the sink outside the bathroom. I like to brush my teeth afterwards.
Brushing is a pretty good idea as it removes any of the drug powder from your mouth. As it's away from the shower and the tub, it should be okay there. What questions do you have for me?
The doctor says this will help my running endurance. When should I notice a difference?
Great question. It might be several weeks. Give it 2 months. That would be 2 of the devices.
Okay.
If you're not noticing a difference, come back. We can try something else. I'm also going to give you a new action plan. I've written the Advair on it in the green section here for you to take 1 puff twice a day. The rest of the plan is exactly the same. There are a couple of copies here so you can have them in different places. Anything else?
No.
Well, if you do think of something, call here. We'd be glad to help. Take care.
Thank you.
After the patient leaves, document the encounter. Documentation is important for effectively tailoring future sessions and receiving compensation for device counseling. Documentation should include, at a minimum, a list of the topics discussed, reviewed aerolyzer technique, cleaning, storage, and refills, a baseline and post-counseling assessment including any teach-back or show-me results. For example, missed initial exhalation, breath hold was 3 seconds, was able to perform both correctly after instruction. In your assessment, it is important to include any patient-specific technique difficulties, issues, or concerns. For example, had trouble unscrewing the cap and holding level, was concerned about need to take a daily medicine. It might also be helpful to document the patient's difficulty or ease in learning the technique. Perhaps the patient needed more than the usual number of attempts or more than the usual amount of time to learn the technique. Document any written materials given or referrals to other resources. Gave FlexHaler pamphlet and referred to video on website. Note if the provider was contacted for a change in device or addition of a holding chamber. Even if a device change is not necessary, consider contacting providers if the patient had significant difficulties. The provider may find this information useful to know for their own follow-up. For compensation, documenting the amount of time spent counseling the patient may be required. List the time frame and frequency for any follow-up. Remember, device technique should be checked regularly as a standard procedure.